Hello, in this video, I am not going to be navigating around a lot so that you're less distracted. It is simple, straightforward to answer a question: why all patients with hepatitis B need to be monitored. It is not unusual to hear when patients are diagnosed with hepatitis and then they do not meet the criteria for treatment and somebody says you are discharged. That should not be the case. I know some of the reason behind is due to ignorance and sometimes because of excess workload and sometimes is because people just wouldn't be bothered. But this diagram describes to us why patients with hepatitis B need to be monitored. For those who have had the journey of having a diagnosis of acute infection, a majority of them will get better and healthy. So they wouldn't need any follow-up in that regard. Patients who have acute can go on to having chronic inflammation of the liver, some of who will recover, very minute in number, really. And then majority of the chronic hepatitis B infected persons will go on to having cirrhosis. Interestingly, I don't know whether that is interesting really, but it's sadly enough, some will never go on to having cirrhosis. They will just go straight on to having liver cancer. This is because the virus itself can integrate within the genetic material of the liver and confuse the DNA to produce cancer cells. So without passing through cirrhosis, it can go on to cancer. For those with cirrhosis, a lot of them, if they do not die from the complications of cirrhosis, will go on to developing liver cancer. It therefore becomes important that if a patient has a chronic hepatitis B infection, you wouldn't know which ones will go on to cirrhosis or cancer or recover. And so the best thing will be to monitor them and if possibly for life, unless they have actually recovered completely, as in the earlier case. I hope you now understand why when hepatitis B has been diagnosed, you need to be monitored, and there are algorithms for such monitoring. Thank you again, and God bless you.